Take two.
It's Dr. Stephen Rath.
Take three. Take three. Yeah, you got the giggles. Good job, you're making them laugh. You did really good the first. Oh, he's cracked your nose.
This is Dr. Stephen Rath, Fusion Medical Spa, and this video is going to be kind of a throwback Thursday video, and I'll explain my hair in a minute. But not too long ago, a couple months or 6 months, we did a video where we talked about doing platelet-rich plasma injections or stem cell therapy to help regrow hair. So I had a patient in just last week that said, you know, wow, I haven't seen you for a couple months and you definitely have a whole lot more hair. I definitely have been seeing more hair in the areas that we treated. However, I made the mistake the other day while looking in the mirror and looked down and saw an area towards the back of my scalp, kind of the monk's hat area, where looked and thought, oh my gosh, I'm losing my hair. So that isn't an area that we've treated before. We took some blood already. We're spinning it right now, and we're getting ready to do some laser energy therapy, low-level laser, before we do the PRP injections. If my face, my nose looks a little bit red, we are already zapped it for the treating blood vessels. So that's an area that most of us have problems with as we get older. Areas around the corners of the nose, the skin starts to get a little bit thin and the blood vessels become more prominent, so we can get rid of those with intense pulsed light therapy. So stand by a second and I'm going to show you the reason for the hairdo. Okay, so like I hinted at earlier, this is a Throwback Thursday video, and we dug up some pictures from the past, and I'm going to zoom in on this top picture. My hair used to be a whole lot longer, and when I was active duty Army, it was actually long enough that it would, if it wasn't spiked like that, it would hang below my chin. I had a wonderful friend, Geraldine Stanton, that helped me. She put a little bit of color in my hair and spiked it up there. That is a picture of me in Germany with the OH-58 Delta helicopter, and then that's a picture of me in the helicopter again on the inside. So that is kind of the inspiration of the hairdo that I have right now. So without further ado, we are going to stop recording right now. We're going to restart recording with a little bit of laser and then the injections. Okay, so now we are doing low energy laser treatment, and what that's doing is it's opening up some microchannels to help with some topical platelet-rich plasma and platelet-poor plasma. Of course, we're going to also do injections with the platelet-rich plasma. One of the things that we do differently here at Fusion is we try to take into consideration each patient's own comfort level. For me, we put numbing cream on ahead of time for about an hour. I took some Tylenol before about an hour ago, and then we're not using nitrous oxide on me. We have that option with patients, but I do have a little vibrating duct, and so we give the duct to our patients. It's part of the gate theory of pain control. Your mind can only pay attention to so many things at one time. So if I have, I think we call this guy Duck Norris. If I have Duck Norris sitting on my chest, vibrating, while Belinda is inflicting pain upon me, it actually is difficult to pay attention to two things at the same time. And so it's not as stimulating while she's zapping me. So we're going to pause the video again and then pick up when we come and do the injections. Okay, so we're doing the last part of today's treatment. This part is really the most stimulating. I have traded out Duck Norris for Ducky Chan. Ducky Chan is a little bit more comforting than Duck Norris, and it helps me find my area of inner peace. So Stephanie's doing the injections right now, and between the numbing, the duck,
It's another sheet.
and some Tylenol, I'm actually doing really well. So we'll finish the injections, and based on how I did before, and the amount of hair growth that we saw, I'm really excited to see the improvement. It took maybe 4 to 6 weeks to start to see some new growth when we treated the forehead area. Part of the other therapy that I used concurrently was I used the Glytone hairline for a shampoo, conditioner, an oral supplement. It has a minoxidil component and a hair stimulation component. So five different things that I used, 4 topically and 1 orally, and that's part of the big difference that we see with our patients when we're treating them for hair loss. So again, Dr. Stephen Rath with Fusion Medical Spa, and I am currently being injected with platelet-rich plasma from my own body, and really looking forward to seeing the same results that we saw when we treated my forehead area. Thanks for watching.